I'm Don Davis. My wife is Catherine, and we live just south of here in a little town named McDonough. So we're south of Atlanta, about 30 miles.
How long have y'all been married?
28 years.
That's her question. Yeah, 28 years.
And how long has Don been a snorer?
Which was sleep
Sleep
apnea.
apnea?
Sleep apnea.
Okay.
So if just to let you know, if the direction goes in snoring, I would end up steering it away because I really didn't. Of course, most snorers don't know they snore.
Right.
Okay, and no real comments from Catherine on the snoring. So what I came in for was a solution, a better solution to a CPAP machine.
Okay. And how did you, are we?
No.
Okay.
He's just going to do it by hand.
Yeah, that's cool.
Are we probably not talking loud enough?
No, just when it's in the middle like that, it just gets a little booming. So.
Okay.
All right, so Don, you then had sleep apnea. Now, also, a lot of people that have sleep apnea don't know that they have sleep apnea, right?
That's very true, and I think that was the case for me, although over the course of time, I suspected there's got to be some kind of a situation, and I knew from talking with my mother that my father had sleep apnea as well, so I kind of suspected that might be the case.
Yeah, and his daughter, not too long before he had the testing done for it, had gone in and she had sleep apnea, so that triggered that he needed to have that done too.
So is that a genetic, there's a genetic predisposition?
I suppose a possibility.
Well, tell me about the sleep apnea then, when you were losing, you're just waking up tired all the time. Catherine, what were you noticing?
He was tired all the time, irritable, and
Yeah, tired all the time, constantly. Doesn't matter how much sleep you get, how many hours sleep you get, you're still just tired all the time.
Okay.
Well, I gotta calm him down back there.
Catherine can ask him just to be, okay, I'm sorry, this has been sort of disjointed, but we'll get on track here. Tell me about the CPAP treatment you were getting prior to coming into getting the fluid procedure.
Once I had the sleep study done, it was very clear that I, needed a CPAP machine or some kind of treatment for sleep apnea, and so the CPAP machine was prescribed. It was prescribed at a setting of 11, and I used it pretty religiously for over a year. There was a clear indication to me after the first couple of days of using it that it was a significant help. Also, there were maybe a couple of times during the year, circumstance-wise, I was just unable to use it, and it was very apparent when I didn't use it, the difference of going without sleep again was immediate. Okay? So, but it's uncomfortable.
Yeah, for people that don't know what that is, just tell us what that is. Kathy, you can come on in.
I want to make sure I don't have to shut the windows.
Okay.
Yeah, a CPAP machine is a machine that provides continuous positive air pressure to the breathing passageways, which is intended to keep them open so that people that tend to snore or have sleep apnea where the air passages close up when you get sound asleep and relaxed, then that positive air pressure keeps them open and prevents the snoring, and it also helps you to continue breathing. Okay?
But it is...
But it's uncomfortable because you're wearing some type of a mask, and in my case, another interesting thing, and it was a particular problem to me, I would get to sleep at night, and at some point you become relaxed well enough that everything begins to relax, and now the positive air pressure of the CPAP machine begins sending air out your mouth. In other words, it forces your mouth open, and so now instead of the air always being breathed in and out of your lungs, the air begins being pushed out of your mouth. It only takes just a few minutes of that to happen before your mouth and your throat are so dry that you can't swallow.
And that probably wakes you up.
That wakes you up.
And what was that like for you? So you're still, CPAP is helping, but there's still some distractions. Are you able to sleep?
Well, it makes noise, but I learned through time to just turn it off, you know, in my mind and all, but.
She's good at that.
Right.
I even went to extreme measures. I would before I went to sleep, I would tape my mouth closed.
With what kind of tape?
With just the kind of tape if you go to like the bandage area in a drugstore, to try to keep my mouth from coming open from the pressure of the CPAP machine at nighttime. It was that bad.
Now, were you aware at that time, were there any alternatives for you other than the CPAP machine?
There weren't any alternatives that I was aware of that were any better.
So you were just doing what you had to do?
Right, right.
Okay. How did you become familiar with Dr. Herman and his work here?
I decided that with medical advances in our day and time, that I should keep looking for possible solutions. And, you know, had read that there are some surgeries and some other procedures that can be done. So I was simply on a maybe every 3 or 4 month basis going to the internet and doing searches to try to find out, okay, what is out there now that's available to treat sleep apnea, see if I'd missed anything in the past, see if there was anything new, and came upon the pillar procedure.
Okay, and so you came in to learn more about the pillar procedure?
Yes, one of the things that I did right away, after it looked promising, was to check and see, okay, where are some physicians that the company has already worked with that I might be able to go and see. And I thought, Atlanta's a big enough area, surely there's got to be someone here. It was amazing, though, that there was someone, 6-7 miles from my house.
Right. What did Dr. Herman tell you when you met with him about what he could offer with the pillar procedure?
In our discussion, he mentioned that it would most likely be a help and not a cure. I also knew that from the information that I read on the website for the pillar procedure. And we discussed, you know, what was involved, what it was exactly. It was a little difficult to know exactly what the pillar procedure really was until having an opportunity to talk with Dr. Herman. It was really kind of interesting, though, you know, after I found out what was involved, how it was done and everything. And it made sense, and the information that I found on the internet seemed to be credible. And so after discussion with Dr. Herman, we decided, let's go ahead and go with it and see what kind of improvement we get. And then after that, we'll evaluate the situation and see whether or not we want to do anything further or not.
Okay. Well, tell me about that day when you came in to get the procedure done. What were your thoughts, and was it easier than you thought, or?
That was really interesting because I didn't know exactly what to expect. I'm not a real big fan of going to the dentist office, you know, and having having your gums and face and things like that numbed up. But it was surprising, actually, the numbing up part of it was probably more uncomfortable than the actual implant of the procedure itself. And so it went relatively quickly. I think, about 20 minutes?
Yeah, we were in and out in no time.
And I think Catherine was in the room at the same time.
Yeah, I was in
Right.
there with him.
Right? and Dr. Herman recommended 5 implants instead of, I think, the 3. And I think that's based on individual characteristics. And I think that's worked really well, because in the end, there's no question in my mind that the procedure the procedure has turned out better than the CPAP machine. I don't use a CPAP machine at all. My sleep is at least as good, almost certainly better, and I don't have the problem of a mask or any of the other issues that come along with the CPAP machine.
Let's go back to the procedure. You were in the room and you were watching. What were your thoughts during the procedure?
It was interesting, and I thought, well, if it works, it works. Good. Because I know he was frustrated with the CPAP machine and all that he had to do with that. And with him being frustrated, I knew that if this worked, we'd be fine.
So you're in and out in 20 minutes,
Right.
and remember that first night?
It took a while for him, you know, it doesn't work overnight, but it took a while for him not to work. He was.
Well, the procedure itself, of course, leaves you with a pretty sore throat, and I'm sure that depends on the individual. So it was 2 or 3 days before things began to get back to normal. And as Dr. Herman has said, it's something that gradually improves over the course of time for, I don't know, approximately 3 or 4 months. Okay? But I noticed improvement right away for my sleep apnea. And
you say it's been 16 months.
it's been 16 months.
So has your sleep apnea lessened, or have you progressed to a point now that it's different 16 months later than it was the first month later, or is it you're just on course?
No, I really have to say, probably better now than even then, although I think it's probably leveled out. Okay. But the reason is I can actually go on less than 8 hours of sleep at night now and not do too bad if the needs be. In fact, I got called and had to work for my company last night till about 2 in the morning. Okay. And I actually feel pretty good this morning.
Would you say that getting this procedure done has changed your life?
For me, it certainly has.
How would you put that into words?
As one gets older, I think one begins to realize, probably even more so than time, one's health is maybe most important, and being able to get a good night's sleep is a terrific thing.
Were you surprised at the results?
They turned out better than I expected, and that was great, because my discussions with Dr. Herman, were that it's probably not going to be a cure. My sleep apnea was severe enough that it was not likely at that time that it would enable me to get off the CPAP machine. But from my point of view, it certainly has done that.
You're off the machine.
Absolutely, yeah.
Do you feel any different? Do you feel those implants? Do you feel any
No, not at all. That's the amazing thing about it, is that even from the beginning, of course in the beginning, when you have a procedure, there's a little bit of tenderness and things like that, but it was practically no awareness that there's any implants there at all, and if I didn't know I had them, I'd have no idea that they were there.
What about the actual experience here, Dr. Herman, the people that work here, how they made you comfortable, how they handled everything? Is there anything you can say about that?
It's really been, I like coming to talk with Dr. Herman. He's a very interesting person. and somebody, somebody that you can actually, he has a great personality. So, when I come in, I know I get good medical treatment as well as somebody that I enjoy coming to see. And the staff has been fine. The staff has been really great.
Do you come in for follow-up care after you get the initial procedure? You come back for him to check periodically? Is that what brings you
Yes,
back
he
in?
scheduled 2 or 3, and I don't recall exactly how many, 2 or 3 follow-ups. And those are intended to make sure that the implants are in the right locations, and that they're healing okay, and that everything, looks good. Since it's the type of situation where once the implants go in, of course, then there's a period of time which the implants and the tissue that's around them kind of work together, and so that needs to be looked at with some follow-ups to make sure everything is fine.
And everything is fine?
Oh, of course, yeah, absolutely.
Catherine, you mentioned that prior to the CPAP machine and prior to the pillow procedure that Don was a little irritable.
Yeah.
Would you say he's a little less irritable now?
Yes, a whole lot better. And he sleeps at night too, and it's, I can tell the difference. He's getting a better night's sleep than he was with the CPAP machine, or before he even had the CPAP machine. He's sleeping better, and he doesn't get irritable like he was before. And he doesn't sleep, he doesn't sleep as long as he used to, because he'd have to sleep sometimes several, like 12 hours. Really didn't get even good, any kind of sleep at all. So, yeah, the pillows have really made a difference.
Have y'all had an opportunity or occasion to recommend this procedure to anyone else?
One of my coworkers, as a matter of fact, within a few weeks after I had the procedure done, he was diagnosed with sleep apnea, and I talked with him about it and recommended it to him as well. I don't think that he's been able to pursue and follow up with
Well,
it.
what did you say to him? I mean, what were your selling points for the pillow procedure?